Hi, I'm RitaBauer. I'm a photographer and I specialized in medical photography. And I've spent the last 30 plus years at the University of Toronto Faculty of Dentistry, where I was the medical photographer and then became manager of the media services before I started teaching dental photography full-time under Bauer Seminars Inc. I've given over 900 presentation, lectures and workshops, and I'm proud to say that I have made life easy for many dental teams by teaching them dental photography and helping them document their patients in a fast, efficient manner. Today's lecture is Dental Photography Made Easy. Welcome to dental photography in the dental practice. Dental photography is a very specialized subject. All images must be clinically correct. They have to reflect the exact measurements and condition of the patient. You can't just take pictures and snap them and hope for the best. This is very specific and all the rules have to be followed. The standard clinical photographic series of every patient in a dental photograph should consist of an anterior facial view, teeth in occlusion with the lips in repose, then a great big smile and a right lateral. And of course, if you're doing specific work and very extensive work, you would probably do the left and the right lateral with a smile, without a smile, just so the communication with the dental lab is going to be sufficient. The next shot you would take is a great big smile. And many people that don't have beautiful teeth or are embarrassed about their smile will not give you a smile. Now I know, for instance, for myself, when I have a photograph taken, I know I have a big gummy smile. So I will never show that when I know that the camera is pointed at me. So for instance, if you say smile to me, I will do this. But really, as a dentist and for the dental lab, they want to show that I have a big gummy smile. So you have to tell the patient, I need to see how much gum and how much teeth you're showing so I can design the perfect smile for you. Then the patient knows that you're not taking the photograph just to make them look pretty. You're taking a photograph to get a record, to get information, and they will start cooperating. The next, you will take two retractors and you place them in the patient's mouth. Patient bites, teeth in occlusion. If you feel that the patient has a dual bite or does a fake bite, ask them to put the tongue against the roof of their mouth and ask them to bite down. And you take a good photograph. The second frontal intraoral shot would be with the teeth slightly open. This gives you a lot of information that you would not have any other way. And then we get the right and the left lateral. And then we take the retractor and the mirror. And it has to be a heated mirror so it doesn't fog up. And we take the upper occlusal surface and the mandibular view. When you're taking photographs of shade tabs to communicate with your dental lab, the shade tab number should be in every photograph. You have to hold the shade tab at exactly the same level, at the same plane as other teeth. You cannot have before or behind the teeth because that would give you a totally different color and a totally different density. Ideally, you would get a flexi palette, which is a contraster, a black piece of plastic that is pushed behind the teeth, and this separates the shade tab and the teeth, and you will get a very clear image of the color and the density of the teeth. Now, if you're photographing pathology, you're really documenting the changes, and you should be placing a probe very close to the lesion or the change in the gingiva or growth, just so you get an idea of how large the area is, and you can document it this way. Now, again, the probe needs to be very close to the area so you don't get the wrong information or distorted information. When we are photographing patients that have a lesion on their lips or in their mouth, we cannot put retractors in the mouth because it's way too uncomfortable for the patient. So we ask the patient to pull the lip down, themselves because we don't know when it starts hurting. But you have to get the patient to put a pair of gloves on. And remember to tell them why. Just tell them, I cannot show an ungloved hand near the mouth. For real close-ups or buccal shots, we use the kidney-shaped buccal mirror, and we use one retractor to keep the lip cavity open, and you need to place the heated mirror into the mouth and manipulate it so you see the exact image that you want to see on the mirror. We don't want any actual tooth in the photograph, only the mirror image. Now, which cameras should you buy? We have a series of cameras. We have the single lens reflex camera with the 100mm macro lens and the ring flash. And a lot of people are getting into the 100mm single lens reflex camera and the dual flash. The dual flash is a very good thing. It gives you excellent images. However, if you would like your dental assistants to take the photographs, the dual flash is just impossible for them to use. They will not get consistent results because it's very time consuming. It's easy to forget to turn units on and off for different views. So I would not recommend it. If you have a busy practice and a number of people are taking photographs, don't go into that system. This is a one-man system or one-woman system. Now there are some small point-and-shoot cameras. There's a Canon system that is sold by Photomed. I don't really recommend it because I don't like to have that many parts that I have to take it apart and attach again to take facial views and clinical intraoral views. My favorite point-and-shoot camera now is the Olympus Clinicam. It's available in Canada under Clinicam, and it is available in the United States from Dine Corporation, the Dine Special. An amazing camera, and only made for dental photography, is the Eye Special, and it is a wonderful system. If you only need one camera and you want your dental team to take a lot of photographs, it is very expensive. It's about $3,000, but it is very light, very easy to use, and it is certainly worth the investment. Now, all these cameras, whichever one you're using, has to be programmed for dental photography. You have to set the right aperture, the opening in the lens. The flash must be going off every time you take the photographs, because if you're an automatic, depending on how much light you have in the room, the flash either goes off or it doesn't, which gives you a color shift. So if you don't have anybody that can set up the camera for you for dental photography, and don't just go to the camera store because they have not taken photographs of teeth. They know about close-up photography, but they don't know about dental photography. If you don't have anybody that can set it up for you, then just purchase it from a dental photography supplier. They have really good support. They are only a phone call away if you purchase it through them. Don't call them if you buy it from Amazon and then you want them to set it up. Nobody's going to help you out, okay? Now, the biggest complaint with the DSLRs is that they are so heavy, and you will find that there is a lot of resistance from your dental team that they don't want to use the camera. It slows them down. However, if there is enough motivation and if the team has been trained, we get excellent results. And the trained team is also very proud that they can work with professional type camera equipment. Many of you would love to take your photographs with the phone. Now, if you're only using the phone, you will not get good results. But Photomed has come up with a system where you can have 2 light units attached to your phone, and this is actually an excellent way to get clinical photographs. Now remember, using a phone has many issues. You have to use it on airplane mode because you're not allowed to upload your images into the cloud. And there are many HIPAA requirements for using a phone, so you have to follow all the procedures. But I think it is the way to go in the future, that we will probably all of us, will be taking photographs with our phones. But you need the light units to get excellent clinical views. So many of you have an issue that you're getting red eye. And red eye is only happening because your room is too dark. You need to have an area where you can put a light behind the photographer, or that there's a lot of light in the room. You can't just go into a small dark corridor and take photographs. You get red eye because the iris is wide open, and when the flash goes off, it reflects off your retina. So you can place a light behind the photographer so that the patient looks into the light, and then you will never get red eye. The background selection, well, we have been using white background, but we are using a backlight in order to get no density at all. Okay. So we're using a backlight in order to get a clear white background. If you're just using a white wall, you will see a little bit of a gray, and you'll see a tiny little bit of a shadow around the patient. Some camera suppliers suggest that you use a black background because it just eliminates every shadow. It just doesn't show the shadow. But what do you do when you have a patient that has black hair, or when you have a patient that has dark skin? They basically disappear into the background. And I would not use a color background, because depending how far the patient is away from the background, if you're using a blue background, if they're standing closer, it's lighter. If they're standing further away, it's darker. So you can never repeat the color. Now, the positioning of the patient is very important. I like to have my patients standing, if I can, with their feet slightly apart. But remember, the camera has to be at eye level with the patient. So if you have a tall patient, they're going to have to sit in some bar stool that you can raise up and down. And every patient has a slight head tilt. So you have to position the patient that the face is straight. Now, the hair has to be placed behind the ears, because the ears are a landmark. And when you're taking a facial analysis, you need to see the ears. So now, this is not a portrait. We are taking a clinical photograph. Ideally, any patient with long hair is going to put their hair in a ponytail, and then you can do your measurements. Glasses are removed, and large earrings are removed. If you're getting shadows in front of the face on a profile view, it means that your flash is in the wrong position. All you have to do is turn the camera the other way so that the flash is always shining towards the midline. And then the shadow will be behind the patient, not in front of the face. Light boxes eliminate all shadows. Okay, they are available from DynCorp, from PhotoMed. There's a number of places that you can buy these light boxes. Don't get an old flash box, because they won't synchronize with your newer cameras. For any facial or clinical view, intraoral view, you have to make sure that the lens is at the correct focal length. Now, we are talking about your zoom. If you're having a zoom lens from the point and shoot, if you have a single lens reflex camera, you have a fixed 100mm macro lens. Okay? Because if you're shooting in wide angle, or if you're just photographing too close, and it's the same for the telephone also, you have to zoom in to the same level as a 100mm macro lens, so you don't get distortion and you don't get this barrel-shaped mouth or barrel-shaped face. So we have the 100mm macro lenses, and usually you will see on a macro lens, you'll also see the magnification level. So make sure that it's always set to the same. For instance, on a 100mm macro lens, it will be the 1:3 magnification for all intraoral views, and the 1:10 magnification for the facial views. So when you're taking photographs and you're just randomly taking facial views, everybody is going to take them at a different distance. You need to preset your lens. So the way you do that for the first, when you're setting up your camera, you focus on an average adult size face, and you focus from the collarbone with a little space on top of the head. Then you look on your lens and what is the distance on the lens. And on a Canon lens, you will be just before 3 meters, even though you're not going to be 3 meters away. But that's what you're looking for. You preset that again. And on a Nikon 100mm macro lens, it will be 1.5 meters. But focus on it, make it happen for your practice. The next thing is I would mark the floor for the patient. And when the patient comes in, they go to the predetermined area and you say, put your toes against the line. Now, remember, you focus from the collarbone to a little space above the head. And then you mark the space for you, for the photographer. And in future, that's where you're going to stand. And that's where the patient is going to stand. So now you're standardized. It's very important that we position the patient's head with the Frankfurt plane parallel to the floor, because every patient has a habitual head position. They might hold the head low, they might hold the head high. But as you can see on this photograph, it changes the facial structure drastically. So make sure that you position the patient's head. So especially the slight head tilt. Now what happens when a patient has a slight head tilt, if you go up to the patient and you position their face, by the time you turn around and you go back to your spot, the patient's head is moved back because that's what they feel is a straight head. So what I do, if a patient has the head tilted like this, I use my hand and I hold it out at an exact angle how the patient's head is tilted, and then tell them, follow my hand, and they'll position it. Move it up, move it down, turn it sideways, turn it sideways. It works every time and you don't have to move from your spot. The Frankfurt plane is that imaginary line from the orbit to the tragus, and the patient's head has to be perfectly positioned so that Frankfurt plane is parallel to the floor. The other thing is, when the patient's head is tilted, if you can possibly put a mirror on the wall for the profile view, so you can tell the patient, look in the mirror and make sure your head is straight, then you don't have to go around and position them again. It's a real time saver. Okay, you see how, again, how the profile changes when the head is slightly tilted. The biggest mistake that I see in every practice, when I go for training, everybody photographs the patient's profile from behind. So why is that? I couldn't figure it out, because you know faces better than anybody else. And then I realized what happens is you're positioning yourself with the patient perfectly in front of you, and then you're taking the frontal view, and then when you tell the patient to turn sideways, the patient steps forward, and all you do is you stay in the same spot and you move the camera. So the lens is actually behind the patient's face. Now we're losing at least 1 inch from the profile if you don't step with the patient to capture the true profile view. Now, when is it a true profile? The only way where we can tell is if we get the patient to open their mouth slightly, then we get them to turn their face until the 2 corners of the mouth become one. At one stage, it become one. And that's a true profile. Now, you're not going to do this with every patient, of course, but if you're not sure in the very beginning, make sure that you try this a few times so you see where the true profile is. As I said, in dentistry, you know faces. As long as you remember that step with the patient if they step forward when you're taking a profile view. The retractors that we're using are as important as your cameras, as anything else when you're doing dental photography. You have to match the size of the retractor to the mouth. Now we have a number of retractors in dental practice, and the only ones that I purchase are double-ended retractors. Because on my mouth, I would start with the large end of the retractors, but when I do the lateral view, I can't pull enough with this large side, so I leave the large one in and I switch to the small. That will give me an extra tooth. Of course, we also need the very small child-size retractor, and it's not always for children. We have plenty of adults that need the small retractors. I see these retractors in many practices. I have never used this large retractor. There is no mouth that's big enough for this retractor. This size is very good, but this is for a very large mouth, very flexible, very large mouth. So when you purchase these retractors, make sure you're purchasing the retractors that can be autoclaved. The maximum you can autoclave is at 260 degrees, and it has to be on plastic setting. If you're not putting them on plastic setting, you're going to get those cloudy retractors. One more thing I've learned over the last few years is that when the retractors have just been wiped down or they are not rinsed well, you have to rinse them with water. Any remnant of whatever you're using to wipe them will make the retractor also cloudy. My supplier for my retractor is Summit Ortho. This is a small company in the States. I often just call them. I have given you the numbers where you can order them. Of course, order them wherever you want, but make sure you're going to get the right retractor, because many people, they buy them from Amazon, they're getting a product that looks like it, but they will not hold up. So to me, it's worth purchasing the right equipment, the right retractor, and then not having to worry about it. You're not always saving when you're going for the lowest price. I have no financial interest in anything that I'm telling you. The latest that I couldn't live without is this retractor. This is the lip retractor for occlusal views, and it is just amazing. We have had other retractors like this. They have a fork, but they are uncomfortable for the patient, and they really only work for very small mouths. So this is an investment that everybody that uses these loves them. So run out and get them. There are many other retractors I'm showing you, and you can see on the slides which ones I recommend and which ones just don't work for me. If you have the blue single-ended retractors, all I can tell you is the large is too large, the small is too small, and you need 4 retractors in order to get the series, because you're constantly trying to see, does it work or doesn't it work? So I would never buy a single-ended retractor. Once you've placed the retractors into the patient's mouth, stop cross-contamination. Stop cross-contamination. When you place the retractors in the mouth and the lip kind of crawls up and obstructs the gingival attachment, you need to see the gingival attachment in the photograph. All you have to do is flip the retractor slightly. You don't have to do anything else. You don't have to put your finger into the mouth. Train yourself not to cross-contaminate. I only hold the retractor at the handle. I do not touch them in any other way. And I use my patient to hold the retractors as much as I can. So positioning is key. Your camera has to be at the same level as your mouth. If the patient is sitting too low, you're shooting down, and you can see that you're giving the patient a totally different bite. So raise the patient as much as you can so it's at your level. Make sure that you are standing comfortably with the camera right at the same level of the teeth, and then take the photograph. So this is the series that the doctor would want to see. Anterior, right and left lateral, and then the mandibular and the maxillary view. If your photographs are constantly crooked, I couldn't figure out why that was happening all the time. I would always see it. It means that you're holding the camera wrong. It means that you're leaning. On this camera, it would mean that you are holding your eye at an angle on the viewfinder. And when that happens, you will never get a straight photograph. Also, when we lean over our patient, we tend to do this. We tend to hold our head at an angle. One more thing I want to point out too is a lot of people don't want to put their eye on the viewfinder because they don't want to get the smudges on the screen. You have to place your eye straight on the viewfinder. You need to feel the bone touching the viewfinder, and you have to be perfectly straight. With the little point and shoot cameras, of course, same thing happens. You can't take the photograph leaning over with your head tilted. That's when you get the crooked photographs. You have to turn the patient's head, and you have to place the camera perfectly so it's straight in front of the patient's mouth. Never tilting, never looking like this. It'll always be a crooked photograph.